Assisted reproduction technology cycles performed at the Jones Institute have resulted in the birth of thousands of babies and is supported by prestigious research and training programs that are at the core of their operation. Over the last 2 decades, there has been an explosion of knowledge in basic reproductive biology and in the clinical success of assisted reproductive technologies. Many of the advances were achieved by the Jones Institute scientists and physicians.
The master's and PhD program actually came right out of the Jones Institute. It was formed by Dr. Howard Jones, Roger Gosden, myself, and several other faculty from the Jones Institute. Since the time of the first IVF baby in the United States, one of the paradigms that we've always really established and followed through on is that of training. We feel that we need to train the future embryologists, reproductive endocrinologists, and andrologists. The Jones Institute, under the tutelage of Dr. Howard Jones and Georgiana Jones, they started a fellowship program, and they were the first in the country. And basically all the primary or original fellows went out and began their own clinics, and they also started their own fellowships. And so it's like a web. And since then, we've also started the master's in 2003 and have had successful graduates for the last 15 years. And we also started the PhD program about 3 years ago. All those people that started managing and running IVF labs 35 years ago are getting ready to retire. And so we are trying to meet a need that is actually, I don't want to say it's a crisis, but it's close. So time-lapse imaging is an ideal way to explore what an embryo does during normal development and abnormal development. It helps the student to be able to compare and contrast what happens during embryogenesis and development from all the way from fertilization to blastulation. It also helps us understand the timing, and that's actually a critical component. A faster developing embryo or a slower developing embryo, there may be something wrong with it. It's not hitting its cell cycle correctly, it's not stopping long enough, or it's going too fast through the cell cycle so the normal repair mechanisms don't take place. And it's possible that that embryo, even though it might look really good at the end, at the time of blastulation, it may not be necessarily the best embryo to transfer. It helps them identify what they're looking for, and that's our whole goal, is to make sure that when a student walks out of our master's program, that they're fully informed about what the type of embryo that they're looking for to transfer. I think it's essential. I think one of the things that we discovered early on is that grading embryos and understanding what a good embryo looks like was one of the most challenging things to teach. And using static cultures, but to really truly understand what they're looking at in the static culture, observing during time-lapse helps them really identify those different stages and precisely what they're looking at. It's a superior way. I think that it has really improved our student outcome of being able to grade embryos very effectively. Right now, we are using time-lapse imaging to look at different environmental factors that may play a role in development. So what we're trying to do is understand what might positively or negatively affect the embryo. One of the focuses of our PhD program is looking at environmental toxicology and its influence on infertility, not only in the patient, but also in the culture environment. So we're very, very interested to see if something that we're looking at in the lab, some condition, even plastics, something may be negatively impacting the embryo. And time-lapse imaging is just the ideal way to catch every bit of what is going on with the embryo once it is fertilized and goes all the way through to blastulation. There's a new technique that's being researched right now to do non-invasive pre-implantation genetics testing, and that is for aneuploidy screening. And that technique utilizes spent culture fluid. I think if we could combine time-lapse imaging with siphoning off some of the culture fluid while the embryo is in culture in a microfluidic design where we could take that culture fluid and then pass it right into a system for pre-implantation testing, we could potentially revolutionize how we are selecting embryos in the most least invasive techniques. So that's our goal. We would like to probably do less is more, but in the long run, combining those different technologies and techniques will probably lead us to a revolution in IVF.
The Jones Institute for Reproductive Medicine is a clinical practice of EVMS Medical Group. With the use of time-lapse imaging, the Jones Institute has been an active and prolific leader of scientific advances in infertility treatment worldwide, with outstanding contributions to the specialty of reproductive biology. Their unique combination of proven clinical protocols and advanced research and development techniques provides an unmatched environment for treating infertility. Esco Medical has been their partner in providing innovative technological solutions that meet the demands of the ART industry. With our time-lapse imaging technology, we can provide you detailed morphokinetic data throughout embryo development. This allows all important events to be observed, helping to identify healthy embryos with the highest probability of implantation.